Hello, and welcome to the OAFP Facebook page or YouTube page or wherever you're watching this. My name is Dr. Mike Sevilla. I'm the president-elect of the Ohio Academy of Family Physicians, and we have a really fun and exciting interview coming up with our OAFP Family Physician of the Year. But first, I just want to just have a few announcements. Because as you know, we usually do this as an in-person type of meeting, but just with the state of the world, everything's been switched to virtual. So if you didn't know, there is a OAFP annual membership meeting. It will be on Sunday, August 9th at 7 p.m. It's going to be live on Zoom. And we're going to do a lot of business type of things. You're going to see me in a tie. Being sworn in as president. So that's going to be fun. So you can register that at ohioafp.org. Also, I just want to plug the foundation virtual family medicine party. It's going to be on Friday, August 7th at 7 p.m. You can register again at ohioafp.org. There'll be some fun things from our friends at the foundation there, so you can get more information there. And also, if you didn't know, we got merch. We got merchandise for the foundation. You get masks. You get cool T-shirts. All the proceeds go to the OAFP Foundation. We have our virtual conference shirt. If you didn't see the logos for the doctor's orders, mask and mask plus 6, that type of thing, just to remind your community, your patients. Personally, I got the mask, which I'm going to be wearing in the office and out and about now. So go there and get your merchandise there. Again, all the proceeds go to the OAFP Foundation. So I do want to introduce our OAFP, Ohio Academy of Family Physicians Family Physician of the Year. I'm going to be reading from the fabulous press release that our staff put together here. So the Ohio Academy of Family Physicians is pleased to announce that Heidi Gullett, MD, MPH, is a 2020 Family Physician of the Year award winner. The OAFP annually presents the Family Physician of the Year to an individual who meets and exceeds the criteria of being an outstanding family physician. Other criteria include maintaining high professional standards and service orientations, providing high quality and family-centered continuing health care, and being active in their community. Dr. Gullet has been practicing full spectrum family medicine for 16 years. She attended the Wright State School of Medicine in Dayton and completed a combined residency in family medicine, public health, and general preventative medicine at Oregon Health and Sciences University in Portland. Later attended Case Western to complete a faculty development fellowship to improve behavioral health skills for family medicine faculty. Dr. Gullet is a practicing physician at the Neighborhood Family Medicine Community Health Center and Cleveland Clinic Lutheran Hospital in Cleveland. She also serves as the medical director of the Cuyahoga County Board of Health and serves as a population liaison with CASE and Title X director, and served as a COVID-19 incident commander. In addition to her clinical and public service roles, I know it's a lot already, huh? She's also associate professor of the Center of Community Health Integration and the Department of Family Medicine at CASE. Dr. Gullet has also served as program director for the University Hospital's Public Health General Preventative Medicine Residency and core faculty at the Family Medicine Residency Program. So with all that in mind, we'd like to welcome to our conversation Dr. Heidi Gullett, the Family Physician of the Year. It's great to meet you. Congratulations on your award.
Thank you so much. I'm so grateful to have this time to talk with you about family medicine, and also I'm really so grateful to the OAFP for this honor.
So, as I talk with family medicine physicians all the time, I always ask them, or remind them, just remember kind of where you came from. So people who don't know you, share with the audience, where you've come from and kind of how you weaved your way to find family medicine as a specialty.
Yeah, it's a great question. So I grew up in Youngstown, Ohio, up in the northeast part of the state, and found my way to Denison University near Columbus for my undergrad training. And I studied biochemistry because I was really fascinated by the way that our bodies function and the sort of molecular side of things. And I think I had really bought into sort of the reductionist understanding. Like if I could understand the little parts and how they fit together, I could understand so much more. And it was so interesting. But while at Denison, I discovered sociology and anthropology and really began to think about systems and understand the way that social factors and systems impact individuals and their lives and communities, and really thought that medicine would be a great combination of the two, and was really fortunate to land at Wright State, where there's just an amazing emphasis on primary care and specifically on family medicine, and really began to see the beauty in what continuity can do. And so I found a love of family medicine there, and really love the life course perspective and the ability to sort of bring those worlds of understanding the amazing science of our bodies, but also understanding the social context in which people live. So with that, I decided to do a combined residency in family medicine and public health and preventive medicine. And that latter allows you to look more at populations and systems. And so there are only a few of those combined residencies in the country. So I was so grateful to land in one of them with my husband. We couples matched. He's an emergency physician, and we spent 4 years in Portland. And then I entered the National Health Service Corps and worked in FQHCs. Well, my residency was in FQHC, and worked in rural practice in a rural federally qualified health center, and then finished my commitment back home in Youngstown at a FQHC there. And so I've really had this sort of full circle tour of the country and landed back home. But as most of us do, we come home to raise our little Buckeyes back here in Ohio. And I'm really thrilled to be able to still be doing family medicine, but also here in Northeast Ohio.
That's great. I mean, I'm from Youngstown. I was born and grew up in Youngstown, so I had no idea before before you started talking that we have that connection. What FQHC were you when you're here?
So I do also have this theory in the world that everyone is only like 2 degrees of separation away from Youngstown, because I have been all over the world and all over this country, and people always have some connection to Youngstown. So I just have this theory, and
there you go.
Can't talk me out of it. I was at One Health, Ohio.
Okay,
Ohio Northeast Health Systems, and then while I was there, we rebranded to One Health.
Right. That's right. I know people there right now. So yeah, they're a great organization and great people there. So I wanted to dive in a little bit, and you mentioned preventative medicine and public health, and and especially when you're talking with your community, you're talking with medical students and things. Share with me and the audience your passion for public health and community medicine. Why do you think it's so important for our community to know about it, for students to know about public health?
Yeah, so family medicine is amazing because you get to build relationships with people over time, and you get to see parts of their lives, and people share with you and trust you in a way, sometimes unearned trust, which I never want to take for granted, really deep parts of their life. And sometimes those are joyous and sometimes they're very painful. But one of the things I realized early in practice and really in medical school was that the conditions in which people live, the context in which they live, has such an impact on their lives, and the way that they have the choices that they have and the ability they have to reach their full potential, the things they want to do in their lives and the things they care about most. And so for me, that became a really important piece I needed to understand. And I found that public health and preventive medicine as a specialty, a medical specialty, really helped me understand that more. So it gave me the tools to understand that context. And so I'm pretty passionate that every physician and really every healthcare professional, regardless of specialty, needs to understand some elements of that. We live in context, every single one of us. And no matter what kind of doc you are, you need to understand that person in context and think about how you can best partner with them for whatever treatment plan you might be needing to craft alongside them. So that's why I think it's so important. And I think it's been laid completely open about how important public health is in the midst of the novel coronavirus pandemic. But I think there's so much more than just an emerging infectious disease. This is about understanding the impacts of things like poverty and racism on our patients and the lives that they lead. And our job in advocacy, I think, is not just in medicine, but in public health, particularly as family docs, because we have that window into people's lives that's really unique and important.
And I do want to follow up on your role as a public health leader, but I do want you to kind of share with the audience, kind of your job now. Tell me a little bit about neighborhood family practice. Tell me about your practice. Tell me about your passion for clinical medicine. Share a little bit with the audience about that.
Absolutely. So one of the cool things about family medicine is that you get to take care of people from newborns all the way through people that are over 100. And it's really cool because you get to practice medicine in so many different ways. And I love federally qualified health centers because they give you the opportunity to practice medicine regardless of people's ability to pay. They give you the chance to really spend time with people. And even though we all have pressures of the number of patients we see and that sort of thing, I feel like when you're practicing in that kind of environment, you really have the ability to advocate for what your patients need on a different level. So I've been thrilled to be at Neighborhood Family Practice since early 2015, so over 5 years now. And there we have this amazing practice. So I still see patients that I have seen in my other practices prior to going there. So I see patients I've seen for 10 years now. And then I also have been able to be a part of our refugee program for newly arriving families in the Federal Refugee Resettlement Program, which Dr. Conway was a huge part of developing and growing. And then I really get to practice alongside amazing other practitioners, so midwives and nurse practitioners and psychiatrists. And we also have an opportunity there to be really an academic community health center, if there is such a formal term. We always have learners. So we always have nursing students and medical students and residents. And we believe that training the next generation of healthcare providers in equity grounded primary care is really what we need to do as a community organization. So I can't say enough about my practice. I have the ability to still do inpatient medicine. And for 10 years I did, not at NFP, but my prior practice, I did maternity care, including operative obstetrics. So really have had the opportunity to practice full spectrum family medicine in a way that has been life-changing. And I really hope that students who are thinking about this family medicine as a specialty see the joy and the beauty in what we do and how we can be change agents as well.
It's fabulous. And you work with students. And I think you do participate with the foundation preceptorship program. How does that kind of renew and refresh your love for family medicine?
Yeah, absolutely. So I've been fortunate at Case to have the opportunity for the last 7 or 8 years to work with all of the incoming first-year medical students when they first arrive, and that's when we talk to them about all the foundations of medicine and public health and things like that. But then the cool part is I've been able to work with them in their clinical rotations, so their pre-clerkship rotations in the first few years, and then sometimes into the clerkship years and sometimes in electives. And so seeing people across the continuum of medical education is so cool because you get to see what people need at different parts of their development, professional development. And one of the things I have shared with others before is that I never tire of seeing a first-year medical student in the office see a cervix for the first time. They're like, "Oh my gosh, it's a cervix!" And you're like, I see this all the time, and I take for granted how amazing it is to have the opportunity to serve women and to, do these procedures that seem mundane to us, but they're so passionate about how exciting it is to be a new learner in health professions education. And so I never tire of that, and it keeps me excited. But then seeing students mature and then graduate from the white coat ceremony to graduation and then into residency is just incredible because you see people develop and they're stressing out about learning basic science and integrating with clinical decision-making. And the next thing you know, they're able to see patients independently and they're launching off into the world to be that great doc. And so it's just really exciting. And they also keep you on your toes. Like they're constantly
Oh yeah.
teaching you new things. So I learned so much by having students in residency.
Now, when you talk with medical students and undergraduate students, and they say, hey, I want to do, an OBGYN residency, because family docs, they don't deliver babies anymore, and they don't do full spectrum or whatever. Well, what is your response to that, and how do you educate these students on what all that family medicine docs can do?
Yeah, so I really think that family medicine has obviously evolved since our birth, and there are definitely health system pressures which have changed our scope of practice, and not always for the better. But what I would say is that the 10 years I practiced maternity care, including C-sections and tubals, and I still do a colposcopy practice. You can do procedural family medicine, and you can do it in a way that's family centered. Like being able to labor with a family and to be, to follow them through prenatal care, to labor with them, and to be able to catch the baby and assist mom in delivering the baby, and then be able to see that kiddo grow is just unlike anything you have ever experienced in your life. And it's magnificent. So, I feel like it's still a role that family docs have in our healthcare system. And it's definitely something that's still there. I served as our family medicine obstetrics fellowship director for a couple years. And we were, holding on to that. And unfortunately, it was a casualty of the transformation of the American healthcare system, and we don't have that program anymore. But there definitely still are places you can train to do that, and my program at OHSU was one of them. And I'm forever grateful for the people who trained me and launched me into rural practice, where I did C-sections, right out of the gate, and was able to really have a very cool practice.
I do want to kind of reflect back kind of on your public health role, the very important role of medical director at Cuyahoga County Board of Health. Maybe just to share a little bit of the audience, kind of a snapshot of maybe how your year started and kind of how it's been, going.
Yeah, so the backstory is that in 2013, the dean at the School of Medicine, one of the 3 strategic priorities for the School of Medicine was to focus on improving community health. So it was excellence in research, education, and improvement in community health. And so at that time, I was given the inaugural role of being in this population health liaison position, which was a new role, and it was really trying to figure out how we could better partner from academic medicine and public health to really foster health improvement in a meaningful and pragmatic way. And so that was the beginning of a real transformation in my career. And so through that grew some of the roles that I have now, which is like working with Title X at our health department, which is, a federal program to provide sexually transmitted infection treatment and screening and family planning services. But also I then became the agency medical director. And typically it's a contract role, few hours a month, not so in a pandemic. I really am so grateful for my role at the Board of Health. And I think having been there since 2013, I was able to develop relationships that really helped me function in a different role, like in an incident command role, which is more than just what a medical director would normally do for a health department, which typically those are part-time, again, contract roles that just provide guidance on, protocols and anything that might come up on an outbreak investigation or something like that. So beginning in March, our amazing health commissioner, Terry Allen, has mentored me for all these years, but he gave me the opportunity to step into a leadership role in our response. And it's been intense. It was a matter of designing our Cuyahoga County response. The Cleveland Department of Public Health, they have their own health department in the city of Cleveland, but we work hand in hand with them. And then we serve the rest of greater Cleveland. And so it was really a matter of figuring out what is the public health response? What does that look like? And it's been through a lot of phases since March, since we had the first few cases. I still remember being at City Hall when we got the call about the first couple cases. There was actually a press conference already scheduled. And then boom, we heard about the cases. The press conference was delayed a bit. And, it just took off from there. So it's been an interesting ride. Most recently, I've been working on a lot of our testing strategy and trying to get testing into neighborhoods and working with our community health centers and other community partners like Metro Health on that. So it's been a real interesting ride, a massive amount of professional development in a short time, kind of like the most intense fellowship I could ever imagine in like 4 months. But good news is residency and being in rural practice prepared me for the hours and kind of, being ready to think on my feet and just figure it out.
So as we record this, the governor of the state of Ohio is announced a mandate for masks in all counties in Ohio. And as you talk with community members, as you talk with press, what do you tell them about the importance of wearing a mask in the state of Ohio?
Yeah, so one of the roles of being in this medical director public health role has been communication with the press and communication with the public. And it's really important to be clear and concise and direct and repeat the same message. So my message is that we absolutely need people wearing masks. We need people social distancing. I too got my foundation mask, mask plus 6. So as soon as I think I got a notice, it might have shipped. So I will be having it on and I'll be posting photos. But the issue is, in all seriousness, that if we're going to get through this together and we're going to find a way to protect one another and the most vulnerable in our community until we have a vaccine, we have got to do everything in our own spheres of influence. And that means that every single one of us, minus only a handful of people who really can't wear masks, can wear a mask and need to wear a mask. And we need people social distancing. We need people not having get-togethers that are unnecessary. We don't need people spreading it who maybe don't know they have it. And that's happening with a lot of gatherings that we're seeing through our contact tracing. So I'm a huge champion of masks. It's not the only solution, but it's a really important one. And it's not an infringement on individual personal liberties or individual rights. This is a matter of all of us coming together, because the faster we do that, the faster we get our economy back together and we get through this and we get back on with life the way we really want it to return.
I guess on the line here is the Ohio County Family Physician of the Year for 2020, Dr. Heidi Gullet. I'm going to give you some time to think and for some closing thoughts here, but I just want to just to kind of just reflect to the audience is that, especially for community members, medical students, undergraduate students, I mean, maybe you won't see them like, on TV, but there's a lot of family docs behind the scenes doing leadership roles at the local level, at the state level, and then obviously on the national level. And what we're hoping to bring you at the OAFP are a lot of these stories, especially when people are on their mobile devices and on their computers and they have stuff to kind of watch. But we want to share these stories with people. This is one of a number of awesome stories that I'm hoping to really kind of share with all of you, and it's really cool. I love hearing people and watching people when they're really passionate about what they're talking about. So and today's guest has been that too. So. So as we close up our conversation here, Dr. Heidi Gullet, Family Physician of the Year, awesome. So just some closing thoughts on our conversation, or as far as what you see or what you hope to see, with family medicine and family docs in their role and, helping our local communities, through this and the leadership that family medicine has done and will do to help our communities through this pandemic.
Absolutely. So I really believe that family physicians, I think I had said this to Lauren and some others at the OAFP, I really believe we're the lifeblood of the healthcare system, and that we've really got an important role to play pre-pandemic, post-pandemic, but during the pandemic as well. I think people look to trusted sources of information and they look to trusted individuals to help them make the best decisions they can for themselves and their families. And that's really what we as family physicians are trained to do. It's what we love to do. It's what we hope to inspire students to spend their lives doing. Actually, my husband called me this morning. He's working a shift and he had a question that was women's health related. And we sometimes consult each other. It's kind of a nice perk of of marriage. And so he asked me a question and we talked through it. And then at the very end, he texted me and said, "Everyone needs a family doc." And I was like, yes, everybody does need a family doc. And I think, as family physicians, we have weathered an interesting couple of decades with regard to change in the American healthcare system and what that means for us on the front lines in primary care. I think at times there's been an erosion of our ability to maintain continuity and relationship with our patients, but we are a mighty bunch, and we are not going to allow that to leave, because that's really, the relationship is often the essence and sometimes the only therapeutic intervention in our toolkit for that particular situation. And so I am very, very hopeful. I was hopeful before the pandemic that we have thousands of family physicians in this country and around the world who truly believe in the principles of family medicine. Those are principles that stand true as they did at the birth of family medicine, they do now. But we were really, I think, a lot of us trying to figure out what this next phase of the health system looks like, and what is our role as family docs, and how can we maintain those really core elements of what we do. But the pandemic is this interesting opportunity now to, I think, redesign healthcare. And it was a real catalyst. Like, it happened a lot faster than a lot of us thought, right? Telehealth is a really new thing. Like, I don't know how to do telehealth. We're all learning this in real time in our practices. And we don't know what things will look like on the back end of the pandemic. But what I can assure you is that family docs are going to be just as important, if not more important, in the future of an equitable health system as we were before the pandemic. And I think our role in guiding our patients through this and guiding our communities through this is that we do understand evidence, and we do want to communicate that in a way that's accessible to everyone, regardless of any demographic. And we all want people to live their healthiest lives possible, and we want to fight for that. And we want to advocate for whatever conditions we need to make that possible. And so I'm very hopeful. I have a lot of hope in the current group of family docs we have, but I have a lot of hope in the next generation of family docs and healthcare providers. And I am really excited. I always tell the med students, I'm cheering you on. I can't wait to see what you do. But we have a whole bunch of folks not even in med school now who we got to be dedicated to mentoring through as well. So I want to be hopeful about this and leave on a positive note, because it's a tough time for everyone. The pandemic's weighing on everyone, and we have a bright future ahead of us in family medicine, I believe.
That's awesome. That's awesome. I mean, it's just so yeah. On behalf of the OAFP, congratulations again on this award, and thanks so much for your flexibility to just do what we're doing now. Everything is a Zoom meeting now. But thank you for the time. Thank you for sharing your story. Thank you for all the work that you do as a family doc. One of these days we'll be meeting in person, and we're gonna have all this energy and just gonna really change the world. So thank you so much.
Us Youngstown folks, right?
That's right. Youngstown native family physician of the year, Dr. Heidi Gullet.
Thank you so much. Really, thank you so much. There are so many amazing family docs, and I feel so humbled to be chosen, because there are just thousands of other people who are so worthy of this award. And I'm very grateful for your time today as well to talk a little bit about my work, and really excited to see what you do as president of the OAFP, and what else we can do as OAFP members and as family docs going forward.
Thank you. Thank you so much. And for everybody else, get for more information, ohioafp.org. We'll have a YouTube channel, Facebook, we're everywhere. And yeah, we'll bring you more stories soon. So have a great day, everybody. Bye.